I am Captain Nompilo Cleopatra Rabada. I'm a medical aviation doctor at the Institute of Aviation Medicine. I'm also a diving medical qualified doctor. I believe in the principle of lift as you rise. For me to be where I am today, someone had to make the decision that I be part of the Youth Foundation training program. And that is why I believe in the principle of lift as you rise. Now that I am at a privileged point, I am supposed to be a mentor to the young women and the young generation of South Africa, and I will fulfill that principle. I was born in the south coast of Durban. I'm a firstborn of two. I started my primary school at Umkumas Drift Primary School. I went up to Umkumas Secondary School. I graduated matric in 2003. I then went to the University of KwaZulu-Natal, where I did a few years of geology. But then there was an opportunity that came about that the military is recruiting for medicine. So I applied and I then joined the military in 2006 at the Youth Foundation training program. So we were earmarked as students that were going to go into health sciences. And then I did my basic training in 2007 in Luatla, and then went to medical school in 2008. I completed my Bachelor of Medicine and Surgery degree in 2013. Did my 2 years internship at one military hospital, and then during my community service, it is when I decided I would like to join the aviation industry. At that time, the institute was not accepting community service doctors. So I requested to then be placed at Makhado, an Air Force base. So I have been there since my community service in 2016, and then I joined the institute now in 2022. I also did my aviation medical examiner's course. I am qualified by the University of Pretoria in 2017, and also did my flight medical assistance course, and now I'm currently pursuing underwater medicine with the University of Stellenbosch. Aviation medicine is a small portion of occupational medicine, and we assess aviators' medical fitness, taking into conjunction their physiological and their psychological well-being. So an illness that will not cause any issues otherwise on land, you'll find that a person is diabetic and they're doing fine on land, but when you put them up in the air, they will not cope. So we make sure that aviators are medically fit and that they are safe to perform their task. And my inspiration came, like I said, when it came to community service. When I was in 1 mil, I was hearing there is an aviation institute. I'm quite adventurous. I like adventure. And I like going against the grain. So I'm not particularly the type of doctor that you'll find in pediatrics or orthopedics. No, you'll find me doing other things. So like aviation medicine. So that is where the inspiration came from. In the Institute of Aviation Medicine, we have primary responsibilities and also secondary responsibilities. Primary responsibilities is to our client, which is the South African Air Force. Okay, we do initial medicals. So if there's an intake, the Air Force says we have earmarked some people and we want them to be aviators, pilots. We have to be part of that selection. We're doing medicals. We do flight medicals according to the 5 classes in aviation. So pilots, class 1, class 3, air traffic controllers. So we do those medicals, whether on a yearly basis or a 2-yearly basis. We also confirm medicals. So we have our aviation medical doctors who are working under Area Military Health Unit that assist us with medicals in the peripheries. So they do the flight medicals, and the flight medicals come back to us, and we have to confirm and say that this aviator is medically fit according to our standards. We also do aero medical evacuations. We also do medical support. So we are part of the AMED team. We do medical support internally and also externally for the South African Air Force. We are also involved in research. We're an institute. And then we also formulate standards and protocols for aviation. And then the secondary role includes hyperbaric medicine that I am also passionate about. So the hyperbaric medicine, how it comes about, and that's the confusion that people have. Why are you talking hyperbaric medicine when you are in aviation medicine? Okay, hyperbaric medicine is studied under underwater medicine, but it forms a big part of aviation medicine. Okay, so we use it in our initials, like the Colonel had explained earlier. When we're doing these initials for the pilots, you have to stress them sort of in hypobaric environment, so you give them less oxygen. Why do we do that? Remember I spoke about the environment in the air. When you go up in the air, the oxygen concentration decreases. So when you are assessing these people, you want to see their tolerance. Okay, so there is a hyperbaric chamber which is not functioning well at the moment, so we put them there. That's where we stress them. They become disorientated and what have you. We put them back in the hyperbaric. So hyperbaric is high pressurized, 100% oxygen that we give to them. Okay, so also aviators, there's this condition that they are subjected to, okay, which is decompression sickness. Okay, so to treat that, we bring them into the hyperbaric chamber. Okay, it's not so common nowadays because of pressurized aircraft that they are using, but the divers undergo a lot of decompression sickness, and this is our magic chamber to treat that. In high school, you would have to do your subject will have to include math, physics, and biology. Okay, then you will have to do your MBCHB, which is your degree in medicine. Okay, and then afterwards you do your 2-year internship and then your community service, and then you will then venture into the specialty of aviation medicine, where you can do your aviation medical examiner's course, currently being run by us for military aviation doctors, but also the CAA is running another program in conjunction with Sifako Mahato, and then you'll be qualified as an aviation medical examiner. You will also be able to do the flight medical examiner's course, the one I told you, a flight medical attendance course, the one that I told you, which is the practical part of aviation, how you're going to manage a patient during an aeromedical evacuation or medevac or what have you. And then you can also do your honors in aviation medicine. There was a program in South Africa, it's currently being halted, and also your master's in aviation medicine. So you can either do a master's in aviation medicine or you can call it aerospace medicine, but that's what you need to, those are the programs you need to do in order for you to become a specialist in aviation medicine. I would definitely say to a young woman of South Africa, particularly the SANDF SAMS, it's full of opportunities, it's full of possibilities. Okay, as long as you knock on the right doors, do not be discouraged. There's a lot going on and people will tell you do not knock on the doors. If you find your passion, if you know what your purpose is, knock on the right doors. There's definitely opportunities in the Defense Force. And like I explained to you earlier, I am a product of the Youth Foundation Training Program. That program was designed for a young child of South Africa to progress in the military into something that will become a leader someday or an influence in the military. So if they can look at me, I believe that I am that product. Whoever came up with that program today should be inspired, because whatever they did during those times, the decisions that they made is what brought me here today. And I will be an ambassador for the South African Military Health. I also would like to be an ambassador for my patient, especially in aviation. Women's Month to me means freedom. It means freedom, and I don't think it is it is a month to celebrate. It's a month to commemorate, to go back to the thinking of those women who marched in August for freedom. That is what that is the how can I put it? That is the lesson we should still be propagating today. Freedom of education, freedom to walk freely in South Africa, freedom to speak your mind, freedom of speech, freedom for a woman to wear whatever she wants. So that is the lesson that we should still be propagating for years to come, freedom, because I don't think we are still yet free in South Africa as women. But if we're saying we are celebrating, which means we've accomplished, no, we cannot do that. We should still commemorate it and still instill and teach the young ones the importance of freedom for a woman in South Africa.